Mayor of London, Ed Holder, and the Acting Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers. We're also happy to have the members of the media along this afternoon. We already have several questions in the queue and an invitation to those of you who haven't yet submitted questions to put them in. All you need to do is click on the question mark inside the text bubble here on Microsoft Teams. When you do, you can indicate your name as well as your media outlet and who your question is for. And finally, a welcome to our viewers this afternoon, including those tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and viewers who are tuning in on the CTV London website. Let's get to our opening remarks. We'll start today with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. First, I need to acknowledge that today is Holocaust Remembrance Day. As I noted during my State of the City address earlier this week, anti-Semitism remains sadly all too prevalent in today's society. We must not only remember, we must learn about atrocities of the past and present to ensure they never happen again. It is a blight on our society and an impact that is felt too deeply to this day. Equally important, we must support and celebrate our Jewish family, friends, neighbors, co-workers, and colleagues. Let me say this, you matter. And your contributions to London are deeply valued. Thank you. Now, where COVID is concerned, we're still seeing a very slow yet very steady decline in ICU admissions, both locally and provincially. There's also continued evidence we're beyond the peak when it comes to infections. As Dr. Summers and others have noted, however, better does not necessarily equal good. Yes, we're in a better position than we were a few weeks ago, but even with declining rates of hospitalizations and infections, rates are still much higher than what we've seen during the so-called quiet phases of the pandemic. We need to continue to ensure we're wearing high-quality masks when indoors. We need to respect public health measures. And as always, please get your first shot if you haven't. Get your second if you've had your first. And then get your booster as soon as you're eligible. You know, we've hit another milestone earlier this week with more than 90% of all people 12 and up in London Middlesex now doubly vaccinated. By next week, we'll likely cross the 50% mark for those with 3 shots. But it's critical, absolutely critical, that we get that third shot. So even when it comes and seems as if progress has stalled or feels like things are moving in reverse, it's not the case. We continue to make meaningful gains, and together we continue moving forward. Again, as I said at my State of the City address earlier this week, all of this is due to you, those of you who have been doing the right things. And it's why doing the right thing matters, even when it means enduring some of the slings and sneers from those who do otherwise. The 90% who've consistently and continually done the right thing do not, in their own different way, make up for the 10% who've done nothing. So 90%, thank you. That's almost everyone. For that 10%, it's time to get it going. There's never been a time more critical than now. This is absolutely the urgency of now. So that's it for me. Dr. Summers, let me turn it over to you, please.
Thank you, Mayor Holder. Also want to start by acknowledging that it is Holocaust Remembrance Day. And as the Mayor mentioned, it is so critical to remember and to learn and to support our Jewish friends, family, as we celebrate their contributions and recognize the trials of the past. On the COVID front, we are reporting 223 new cases today, 1 new death. Those case counts are still high. However, they are trending in the right direction. We continue to see higher cases through this Omicron wave than what we've seen at any other time to the pandemic. Since the beginning of January, 8,443 cases of COVID-19 have reported, representing almost 30% of all COVID cases identified and reported to the health unit over the course of this entire pandemic. That 8,000, that 30%, however, is a vast underrepresentation of the total amount of cases in our community, recognizing that not as many have been diagnosed as a result of limited access to testing. The Omicron wave has been substantial. It has been large, and it is why we have seen such strain on our hospital system and why public health measures like the restrictions on physical gathering in public spaces have been so critical. We are seeing the plateau and gradual decline of things like percent positivity, of things like outbreaks in long-term care and retirement homes, of cases. We still see high hospitalizations. All of this is possible and has been possible because of the booster campaign, as well as our community's willingness to respect those public health restrictions. This Monday, the province is intending to roll back some of those restrictions, reflecting the plateauing of those public health metrics. I would highlight that we may anticipate a slight surge in cases as a result of the reopening. What we don't know is how high that surge will go. So what we're reminding people is that as we move into reopening, it is still so critical that you wear a high quality mask, that you reduce your social contacts as much as possible this winter, and that you, of course, get vaccinated and get boosted. We've seen tremendous uptake of booster doses in our community, but we've still got a ways to go, particularly for those under the age of 40, where our booster dose coverage remains less than 50% and less than 30% in some age groups. We're strongly encouraging everyone to get boosted as much as possible. We're also making sure that vaccine is available and encouraged amongst 5 to 11-year-olds. Today is National Kids and Vaccine Day, and what a great day to remind folks that the vaccine is safe and effective for kids, and it is critical not only to ensuring that kids can remain in school and can remain doing the activities they love, but also that our community is still able to be open for them to do those things. The National Advisory Committee on Immunization this past week strengthened its recommendation for the vaccine to be given to 5 to 11-year-olds, reflecting the fact that as we've given more and more of this vaccine, it's becoming clear the risks are very little, the benefits are very large. And so therefore we continue to strongly emphasize the importance of vaccination for 5 to 11-year-olds. The province is continuing, the health unit, is continuing to expand options for kids. We will be moving through community hub COVID-19 vaccination clinics in schools. We announced that this morning, with a focus on neighborhoods where vaccine uptake has not been as high as it has been previously. And so those clinics will be available in the late afternoon and early evening in select schools across our district. We have also opened up Earl Nichols Vaccination Center to walk-in appointments, and we anticipate that we will be able to open up Agriplex and the Caradoc Community Center to walk-in appointments starting next week to again remove any additional barriers to getting vaccinated. Our mobile efforts continue in partnership with the Middlesex-London Paramedic Service as well as Middlesex-London Health Unit staff, with efforts to vaccinate in shelters, in community centers, both in the county and in the city. We continue to try and find opportunities for people to get vaccinated. And of course, that also includes pharmacies and primary care centers. Make sure that you take every opportunity to get yourself vaccinated and to encourage your family and friends to get boosted as well. This is absolutely essential if we are to have a successful reopening. Those are the end of my comments today, and we're happy to take any questions. I'm going to pass things back to Dan.
Thank you very much, Dr. Summers, and thank you, Mayor Holder, for your opening remarks today. Well, we do have a number of questions in the queue, and we'll get to those right away. The first question is from Jane Sims, but it's similar to one we have from Jennifer Beeman, both Jane and Jennifer from the London Free Press. So I'm not going to ask, I'm just going to combine those questions. So here we go, Dr. Summers, it's for you. Jane asks, Dr. Summers, can you elaborate on why you chose the schools you did for the community clinics? Also, how many vaccine doses on average do you think you can administer at those sites? And then adding in Jennifer's question, were the locations chosen based on overall vaccine uptake in the area or first and second doses in the 5 to 11-year-old age group?
Thanks for that question, Jane and Jen. In terms of the location of those schools, we have been tracking vaccination coverage by neighborhood since the beginning of this vaccination campaign. And we know that there are neighborhoods where communities face more barriers to vaccination than others. And those barriers can be competing demands of multiple jobs or challenges with transportation, challenges with language, or challenges with just finding the opportunity in the busyness and stress of a day or a week to get to a mass vaccination clinic. So those neighborhoods have been monitored consistently. We have seen lower vaccine uptake in the same neighborhoods over time. It's been consistent, it has not changed. And so we've been able to utilize the consistency of that information for vaccination coverage across all age groups to inform where we are placing our community-based mobile clinics. And that will be the same strategy that we will use not just for the schools based in the clinics based in schools, but also clinics based in community centers or in participating retail centers, et cetera. Our objective is to really make sure that the vaccine is close to home in neighborhoods where clearly folks have not had as easy a time getting vaccinated as other neighborhoods in our community. We, through our mobile clinics, can administer anywhere between 100 to 300 vaccines per day. For example, at our Masonville pop-up clinic, we were well over 400, but that was a bit of a well-oiled machine because we were in the same spot for an extended period of time. It really depends on the demand. Our experience has been that our mobile clinics have been busy but not overwhelmed, and we will hopefully be able to adjust the frequency of our visits depending on the demand. If we go out to a school and we fill up the full day, then you can be sure we'll be back again in order to provide additional opportunities to people in those neighborhoods.
Thank you very much. And I think you covered off Jennifer's question about the 5 to 11-year-old age groups in those neighborhoods as well. So.
Yeah, and just for clarification, the consistency across all age brackets really allows for us to focus on vaccine coverage across all age brackets when we were trying to select which schools to focus on.
Great, thank you very much, Dr. Summers. Let's go to a follow-up question from Jane Sims. Dr. Summers, given the number of long-term care and retirement homes that have been listed with outbreaks and the number of deaths of vaccinated people associated with congregate living, are you satisfied that enough is being done to curb the spread of Omicron in these settings?
As has been the case throughout the pandemic, the most important thing to limit transmission in congregate settings like long-term care and retirement homes is to limit transmission of COVID-19 in the general community beyond those congregate living settings. Those congregate living settings are by their very nature more inherently risky to COVID-19 transmission because it's people living in close contact with one another, and they are folks that may have underlying medical conditions or older age, which makes them more vulnerable to severe outcomes from COVID-19. The most important thing that we can do to limit transmission in those settings is to limit transmission outside of those settings. In terms of what is being done in order to limit transmission in addition to that in those settings, we have focused on ensuring vaccination coverage amongst residents and amongst staff. We have had tremendous partnerships with our facilities to increase vaccine amongst their residents and amongst their staff. However, any gap in vaccination coverage amongst staff or residents is a potential vulnerability, and focusing on vaccination and particularly booster doses, be it third or now fourth doses, is absolutely essential. And there is an urgency to vaccinating as many possible staff and residents as soon as possible. In addition, we focus and really strongly encourage other infection prevention and control strategies, including ensuring that people who are ill are not working, or if they are residents, they are isolated as soon as possible. And of course, that masks are worn with regularity and worn well. We continue to work with these facilities, but again, the way in which we limit transmission in the broader community is how we limit transmission in these settings.
Thank you very much, Dr. Summers. Let's go to the next question, and this one is for Mayor Holder. Mayor Holder, this is from Jane Sims, again at the London Free Press. Mayor Holder, with partial reopening starting next week, will there be increased bylaw officer presence in high-traffic entertainment districts of London?
Well, hi, Jane. I thanks for that question. When the loosening of restrictions occurs at the end of the month, it's going to mean several things. Certainly, restaurants, bars, gyms will be able to be open at half capacity. Not every business, the larger venues, will have that same opportunity. But I will tell you, that for the smaller businesses that have endured so much, they will have that opportunity to reopen. I know as well that the restaurants and bars who've really been challenged by this by the pandemic and with the restrictions as they have changed from time to time. I mean, they've struggled, and I think we all recognize that struggle. At the same time, we have an expectation, both from the health unit, from the city, and that is that employees wear their masks. All customers wear their masks until they're seated and then eating and or drinking. And that's an expectation. I can tell you that bylaw enforcement will maintain its vigilance, and we are extremely aware of the changes as they've come up. We'll deal with things as we have to, but by and large, if I measure it by the last time restrictions were loosened, restaurants and bars almost fully were compliant and did a great job of monitoring that their staff maintained the rules as they're in place. So will we be there, available and visible? Absolutely. Will there be some things that are complaint driven as well? Absolutely. But I'm also confident that the restaurants and bars, particularly in our entertainment district, will be paying close attention to what those rules are. Nobody wants to go back. Nobody. It's been so challenging. They will do the right thing. I'm confident. So will we be there? Yes. Do I feel that they need to be there? Of course. That's an expectation that is made of the city, and bylaw enforcement will be there. But I'm also predicting that we will have very low, if any, challenges associated with compliance. Restaurants and bars have been great.
Thank you very much, Mayor Holder. Let's go to our next question, and it comes from Jennifer Beeman at the London Free Press. Dr. Summers, Jennifer asks, why have some postal code regions been chronically behind on vaccine uptake? Have mobile vaccine efforts in these neighborhoods helped in the past? And I know you spoke a little bit about some of the barriers that exist, but I wonder if there are some other factors that are taken into consideration.
Thanks for that question, Jen. When we look at neighborhoods in Middlesex-London where there's been low vaccine uptake, there are a few things that seem to stand out. One is that they may be neighborhoods where there are other socioeconomic challenges, where there may be other competing demands for priorities beyond vaccination, or there may be language challenges to understand or hear the information that I so readily speak in English here may not be as easy for people to appreciate in those neighborhoods. There are lots of barriers to accessing health services, and they precede the pandemic, but those same issues make it challenging for people to access even vaccination services. One of the efforts of our mobile vaccination campaign is to not only have the vaccine close at hand from a proximity perspective, but also to partner with community leaders in order to ensure that the information and the answers to the reasonable questions around vaccination are available in ways that are understood to people before they make their decisions around vaccination. So we try and partner with community organizations and community leaders. We try to be close at hand. We try to share resources that reach people where they are at. Our mobile vaccination campaigns have helped increase uptake previously. Other things that have helped to increase vaccine uptake include the proof of vaccination requirements from the province. Those proof of vaccination requirements notably increased uptake of vaccine to 2 doses. And although we don't know what the future holds for requiring a 3rd dose as proof of vaccination, this would greatly, I think, increase vaccination uptake. Those types of things are what we take into account as we try to, again, reach people where they are at with all of our efforts, including our mobile efforts. Thanks, Dan.
Thank you, Dr. Summers. The next question is a quick follow-up again from Jennifer Beeman at the Free Press. Dr. Summers, is the health unit planning further school-based clinics in the county?
Thanks for that question, Jen. We will continue to look at vaccination coverage across Middlesex-London and plan mobile clinics accordingly. Critical to all of this is that we are placing clinics in schools as a community hub to that neighborhood. And the county has also had significant mobile efforts through our partnership with the Middlesex-London Paramedic Service, where they've been visiting communities throughout the county already. And in a lot of ways, those really do reflect the same objective of these school-based clinics in communities where vaccine uptake may be lower or where vaccine is harder to access because of distance needed to travel. So we will continue to review across Middlesex-London where vaccine uptake is lower and where clearly there are challenges with access, and return to those places, and that will include consideration of county locations as well.
Thank you very much, Dr. Summers. Let's go to the next question, and it comes to us from Sawyer Bogdan at Global News Radio, 980 CFPL. And I'm going to make, I asked Sawyer a question in the chat and she hasn't got back to me, but I'm going to make an assumption here. Dr. Summers, the province received its first shipment of, and I'm going to assume this is Paxlovid. Does the MLHU now have access to this drug? And if so, how will it be administered locally?
Thanks for that question, Sawyer. The province, yes, has, to our understanding, received its first shipment of Paxlovid. It is a very small amount, and so the province is determining through healthcare services, so not public health units, but things like hospitals, will be determining how it is distributed across the province. My understanding is there will be hubs of clinics where this medication will be available to those with highest risk for poor outcome who currently have mild symptoms. I believe that the referral pathways will include the clinical assessment centers operated through Ontario Health. The Middlesex-London Health Unit will not be involved in the distribution of Paxlovid. Certainly, we will be aware of what's going on, and I will strive to share that with you when we have details, but we will not be directly involved in the distribution and administration of that medication locally. Again, it's a small amount, and it will be distributed through hubs across the province, and I believe the patient pathways will likely be through clinical assessment centers.
Thank you very much. And Sawyer had a quick follow-up, Dr. Summers, and I think you may have this information. Sawyer Bogdan asks, what is the vaccine status of the man in his 80s who was reported on today's dashboard update?
Thanks, Sawyer. Tragically, that gentleman had received 3 doses of vaccine. One of the things I do want to address is the people who have died, particularly in this past month. We have seen a number of deaths, and more deaths, of course, reported this past week from COVID-19. Of those folks who have died, many have been vaccinated. And that understandably leads to the question about why are we getting vaccinated if we still have people who are vaccinated who are dying? The answer lies in the rates of death amongst those that are unvaccinated relative to the rates of death amongst those that are vaccinated. In the month of January, over 25% of those who have died were unvaccinated. Only 7% of our population over age 12 has not received a vaccine. What this means is that the unvaccinated are overrepresented in the number of people who are dying. And if not for the vaccine, the number of deaths in our community would be tragically higher. And so for those who are getting vaccinated, for those who are getting boosted, you continue to do the absolute best thing you can do to reduce your risk of death. And I want to strongly remind folks the importance of getting vaccinated through all of this.
Thank you very much, Dr. Summers. An important message indeed. Let's go to our next question. It's from Brian Bicknell at CTV London. Dr. Summers, how confident are you in the safe return to classes at Western University on Monday?
Thanks, Brian. There are a number of things that are in place to make the return to campus safer. There will be a risk of COVID-19 transmission wherever people gather. And as we've talked about, when it comes to education, that risk of COVID-19 transmission has to be balanced with the risks of no longer being in-person and in-school learning. That includes at the post-secondary level. There's also important to note that the risk of COVID-19 transmission also exists off campus and out of the classroom. So there are many things through our partnership with both Western and Fanshawe and other post-secondary institutions in our region that limit the risk of transmission, including adherence to masks while on campus, mandatory vaccination for those who attend campus, the limited, at this point, congregate living settings on campus, and of course, highlighting that the risk to students also exists in their social activities in bars and restaurants. So as students return to in-person learning in our community, it is critical that they also recognize that they are still working and living through a pandemic and that their social activities are also a critical part of COVID-19 transmission risk. The risk on campus can be limited through some of these regulations and interventions. The risk off campus is harder to control, and that's really truly in the hands of the students.
We have one more question in the queue, and Mayor Holder, this one is for you, and it's from Amanda Margison at CBC London. Mayor Holder, what do you say to the Londoners who went to the 401 today to support the truck convoy?
Well, thanks, Amanda. I think this tiny minority is trying to bolster some numbers that frankly are so not in touch with the extreme majority who have done the right thing to get their shots. And I would encourage those who have the time to go to a truck convoy to take the time to join the 92% who have in London already had their shots, continue to do the right thing, and try to end this pandemic.
Thank you very much, Mayor Holder. There is one more question. Oh, and it's not a question at all. It's Brian Bicknell saying thank you. You're welcome, Brian. Glad to have you along with us today. That does do it for the questions today for this afternoon's virtual media briefing. We thank you. And we will be back with our next virtual media briefing coming up on Monday, the 31st of January. I can't believe we're already talking about the 31st of January. Where does the time go? A lot of us asking that question the last couple of years, indeed. That does it for us, clearly. Does it for me, too. We'll see you next Monday. Have a great rest of your Thursday afternoon. Have a wonderful weekend in between now and Monday. So long for now.